Hey, how you guys doing? I want to go over some medical misinformation that was recently published in a couple of Kansas newspapers. The article is titled KU Health Systems Doctor Highlights Value of COVID Public Health Interventions for At-Risk Children, and it's subtitled Canadian Study Notes General Benefit of Masking, Distancing, and Other Precautions. And I want to make this video here to show how, both those, the title and the subtitle, are not true, and that it's misinformation. And this misinformation was published in the Kansas Reflector on November 29th, 2023. And the author, his name is Tim Carpenter. And then later that day, the exact same article was published in the Lawrence Times. And so I just want to go over a couple of things here to show how this is, it's medical misinformation, and it's also, it's deceptive to the readers, and it's elementary errors in reading and reporting on research and research methods and research findings. And so the name of the study that this article is based off of is called Severe Respiratory Disease Among Children with and Without Medical Complexity During the COVID-19 Pandemic. And it was published on November 14th, 2023 in the JAMA Open Network. And so for the Kansas Reflector and Lawrence Times article, they reported on that study and also brought in a doctor from the KU Health Systems. And so his name is Dr. Dana Hawkinson, and he's the medical director of infection prevention and control at KU Health Systems in Kansas City, Kansas. And so that article from the Kansas Reflector says, University of Kansas Health System physician says a Canadian study affirmed non-pharmaceutical public health interventions during the COVID-19 pandemic decreased respiratory-related hospitalizations, ICU admissions, and deaths among medically fragile children. And so that is just a false statement. The study did not do that. The study specifically and only looked at pre-pandemic period and during the pandemic. So two different periods, one before COVID, leading up to COVID, and then one during COVID, looked at the number of hospital or respiratory-related hospitalizations, ICU admissions, and death among groups of medically fragile children, and to see if there was any difference between the two periods, pre and during COVID. And they found that there was a decrease in all three of those areas, the respiratory illnesses, the ICU admissions, and the deaths in those groups. And that's it. What it did not do is it did not look to see, what caused that. But it did take the liberty to say that they think that this reflects non-pharmaceutical health interventions during COVID, meaning masks, social distancing, and lockdown. So they're saying that, and the doctor says it as if this study found that. But what this study is saying is that, there was a decrease in these areas during COVID, and because it was during COVID and there was increased mask mandates, increased social distancing, and increased lockdowns, that's the reason. That's what caused it. And so, this is an elementary error in research, in statistics, and reporting on findings, and then also interpretation of it. So if you were to take, in any research methods 101 course in college, you would get on day one examples of different kind of errors in research, and one of them would be a spurious relationship. And this so a spurious relationship assumes that there's that because two things happen at the same time, one caused the other. So they give the example in any research methods textbook. You get the example of during summer there's an increased number of drownings, and there's also an increased number of ice cream sales. Therefore, because drownings increased at the same time there's an increase in ice cream sales, that it's ice cream that is the contributing factor for those drownings. Well, and just, it's false, because, just because two things happen at the same time doesn't mean they cause each other. They could, but you can't just assume it. And that's what this article does. It takes a huge liberty and so of doing that, because, like I said, they didn't even do any other kind of statistical analysis on the relationship between the decreases that they found in those hospitalizations and whatnot with COVID prevention measures. They didn't even test that. They just, and so it's not even a spurious relationship, because I would assume some sort of mathematical or statistical connection between the two variables, but this doesn't even do that. So it's just, they just hypothesized that because there was the decrease and because there was the COVID mandate measures in place, that's what it is. And so then the doctor, he just turns around and says to the paper just that it's fact. And so the article, it concludes its very last sentence of its strengths and limitations section on page 9 of the article. It's clear as day. It says, additionally, this study cannot identify causative factors related to the reduction of hospitalization, ICU admissions, and mortality between the two groups, CMC and non-CMC. And we go back to, just the very subtitle of the Kansas Reflector article is Canadian study notes general benefit of masking, distancing, and other precautions. But the study itself says, we cannot say what exactly accounted for that reduction. And so the doctor, Dr. Dana Hawkinson, he's interviewed for this Kansas Reflector article. I'm going to get to what he's quoted as saying, they did see that those mitigation efforts which were used to protect against COVID did also help those very vulnerable children from severe respiratory illness. And so, again, just like I noted, the very last sentence of their strengths and limitations section says, we cannot say, if there was a causative factor between those. It says, again, additionally, this study cannot identify causative factors related to the reduction of hospitalization, ICU admissions, and mortality between CMC and non-CMC. And so, what the article says, they said, we hypothesized that there would be a larger decrease in severe respiratory hospitalization and ICU admissions among CMC compared with non-CMC, reflecting the use of non-pharmaceutical interventions mitigating illness transmission for those particularly at risk for infections. Again, this is just a hypothesis. There's no connection found at all. And on top of that, they didn't even look for that. They say our objective was to evaluate changes in respiratory hospitalizations, ICU admission, and mortality among CMC and non-CMC during the pandemic compared with pre-pandemic. That's the only thing that they looked at, and that's the only kind of statistical test that they ran between in their study, and they ran it just to see if there was a compared difference between number of cases pre-COVID and during COVID. To look for some sort of relationship between that decrease and those COVID mitigation measure mandates. or just the measures themselves. They'd have to do some sort of, regression analysis to look at that and start to see if there was a relationship between the two. And it could be that there is a relationship. I doubt it. All the research I've seen so far is saying no, that mask didn't work. But that would be, the beginning. You'd be able to see if there was an effect, and you could see how big of an effect, and you could start ruling out other variables at play. Again, it's the equivalent of that drownings increase during summer, so and ice cream sales are at the same time, so therefore it's ice cream sales. It's the exact same thing. We saw child hospitalizations and respiratory illnesses and deaths go down during COVID, and it coincided with mask mandates, is basically what it's saying. And so therefore it is that we're ruling out all other variables. There's nothing else that could explain it. And then you got Dr. Hawkinson just saying the same thing. He's not saying, well, he's not pumping the brakes and saying, well, hold on a second, how are we ruling out all these other variables? I mean, there are just, there's so many things that could account for the decrease. Just personal characteristics, parents not taking their children to the hospital during a pandemic. I mean, it might be something like that. It's not, it's not, it's just a huge leap, a huge liberty that they're taking in saying that. And then you got, that Dr. Hawkinson, and you got the Kansas Reflector and the Lawrence Times that are turning around and presenting that to its readers as though it's fact. That's what this article, they're saying that's what this article found, and that it has to do, these decreases are due to basically it's a political thing. They're saying the stuff we advocated for and pushed for is what's working, and so here's the proof right here. And they're deceiving their readers, and I think it says a lot about their readers, and it says a lot about liberals in general. These are really liberal newspapers, and I think it says a lot about them, that they're not very critical in their thinking. They're spoon-fed stuff. They're easily deceived, and they're easily deceived because they think they're so damn smart, and so they don't have any humility whatsoever. So they read this stuff, and it just reaffirms for them that, oh yeah, we were right to be complete tyrants and treat people like shit the whole time. Look, our shit worked. And they don't have to even dig any further than that. They got the newspaper saying it, and they got a doctor saying it, an authority figure saying it. So that's good enough for them. But just if you just scratch the surface, like I did, just read both. Read the study, and you'll see that that this is misinformation. And so I emailed Dr. Dana Hawkinson multiple times last week asking him. So I asked him, I said, show me where in the study it was found that those mitigation efforts helped in the way that you said you did, and where in the author's paper in the study did they say they found what you said they found. So, the study is clear as day. They say we can't say what caused this. We're hypothesizing. So I'm just asking, where did he say? Where does it say in that study that what the mitigation measures were the reason for the decrease? And so I didn't hear back from him. So I followed up with him, and I said, I haven't heard back from you. And so I just had an additional question, and I asked him if he believes that medical misinformation is dangerous to individuals and society. And again, I haven't heard back from him. And that's exactly what this is. This is dangerous medical misinformation. It's deceptive, and it's dangerous. And I think he should resign. I think he should resign because he's either intentionally misleading people, perhaps, with this new respiratory virus coming out of China and into Europe now, maybe perhaps it's being, the ground's being laid for people to want to do these measures again. And maybe so he's saying it because of that. Or maybe he just really is that incompetent when it comes to reading and researching research articles and thinking critically about them. But either way, so he's either intentionally misleading people, or he's incompetent to miss a elementary 101 research methods error. either way, he should not be the director at a KU medical facility. The chief director of that department there, making errors like that or being deceitful like that. And so I was just hoping I'd hear back from him so he could explain where he saw that and how he figured that. But we didn't hear back from him. Not surprised. But anyways, like I said, I'll leave those article links in the description here if you want to check them out. So you don't just take my word for what it says, and leave some comments here. Let me know what you guys think of it, and I appreciate you guys checking out my video and my channel. Talk to you later.